I'm just going to begin with our cases and where we are. Our very first case was diagnosed on March 13th, so in 2020. So we're almost, a full year into this for Bourbon County. Some counties didn't get it for much later, but we were one of the counties that was hit pretty early on. The very first case in Kentucky was diagnosed on March 6th, so we were pretty much just a week behind the very first case that was diagnosed in Kentucky. So we've been at this for a very long time now, and if we want to break it down, this is just some data that I have that I try to keep up with on a weekly basis, just to see how our community's doing and what does the demographics look like. And so as you can see, we've had a total of 1448 cases, and if we want to break that down by gender, we've had about 53% of those are females and 47% are males. And I will say this is data from close of business yesterday, so this does not include any cases that we are actively working today. This was as of close of business yesterday. And then the age breakdown, I broke that down pretty much in increments of 10 years, with the exception of 18 or under 18 and then over 80. So you can kind of see the breakdown of that. And if you take our 18 to 30-year-olds and are greater than or less than 18, that's about a third of our cases that we're dealing with. So obviously that 18 to 30 age group is our largest age group that we've dealt with through the pandemic of our active cases. So we have a racial breakdown. So 84% are Caucasian. We have 6% African American. We have 9% of our cases have been Hispanic. So, and that pretty much is a pretty accurate snapshot of the overall race and ethnicity for Bourbon County. And then if we look at our status, fortunately, we've had 93% of those active cases, that 43% of the 1448 have fully recovered and have been released off isolation. And we currently have 92 cases or 6% active currently right now. And then we have lost 11 people to this virus. And we held strong for a long time with just one death. Unfortunately, our very first case that was diagnosed in March, on March 13th, he actually passed 2 days later. So, he was very sick. But we held strong on that one death for a long time till about a month ago, and then we really started to see an increase in our deaths for Bourbon County. So this is a trend of our cases over time, and again starting in March up till the end. Well, I have February 5th on here, which is today. So you can see we've had 56 cases this week, but that does not include today's numbers. So you can see that our peak through all this was in early January. That was our largest case count by week, which was 135 cases. And since then, we have seen a pretty steady decline in cases over the week, which is wonderful. And that actually kind of matches up with what the state is seeing right now too. If you follow the governor and his reports, you can see that the whole state is pretty much on a steady decline, which is very good. So I have very high hopes that at the end of today, the end of business today, that we will still be on that downward turn. That we will have a couple more than 56 for the end of the week, but I feel pretty confident that we will still see that decline in our weekly case count, which gives me hope, and hopefully gives you hope out there as well. So just talking a little bit about our testing. So back when all this began, testing was very limited, very scarce, and not very many people were able to get tested. The hospital was one of the only outfits in town that was able to test, and even back then, they had to get prior approval to test somebody through the state laboratory, and that only meant if they had symptoms that kind of matched what COVID was, COVID symptoms. So, but as time went on, I know that was a big initiative with the governor, is to get more testing. And luckily, they were able to work out a contract with one of the Kentucky labs, Gravity Lab, and lots of local health departments were able to jump on board with that to offer community-based testing in our community. So we felt that since there wasn't any other like pharmacies that were providing that we decided, that was something that we really needed to offer to our community. So we did that starting in mid-May, and as you can see over time, this is how many weekly tests that we have done. We would have loved to have been able to do this every day, but just Bourbon County Health Department is a small health department with not very many employees, so we had to balance our resources between all of this. So we offered it one day a week for a couple hours. So this was kind of the turnout that we got. So as you can see, we had from May 12th through February 2nd, which was this past week, we've had 1,596 tests done through just the Bourbon County drive-through test site. This does not include any other testing sites in Bourbon County or outside of Bourbon County. This is just the ones that Bourbon County Health Department did. And as you can see, we were kind of peaked out right there in July with our testing, and then we kind of faded away with the amounts in September, and then we picked back up a little bit in October and November. But as you can see, after that, we've really kind of declined in our participation here locally, and I think that's for a couple different reasons. And one is we've got more people in town testing now, and that's great. That's what we need. We need as many community partners to step up and help with this as we can. So obviously, Bourbon Town Pharmacy has been doing this for several months. It's been great. It's a great partnership between us and them. And they offer the rapid antigen test, and I think they do it pretty much daily. I'm not sure if they do it on Sundays, but they do it most days of the week. And it's a rapid test, so you're going to know within 20 minutes what your results are. And then most recently, Walgreens has decided to start testing, and they've been doing this for a couple weeks now, maybe even longer than that. And they offer it 7 days a week, and they are offering it. They actually have a grant that they are able to offer it at no cost to individuals. And that includes people who are undocumented and people who don't have insurance. They can still go through and get tested at no cost. They're testing children, and their test is actually what's called a PCR test, and that is the same test that we did here locally, here at the health department, and that gets sent off to a lab. So it's a little bit more of a sensitive test than the rapid antigen test, and it takes about, I talked to Walgreens the other day, and they said that it's anywhere between 24 and 72 hours they'll get the results back. So that's basically pretty much our timeline too that we saw here at Bourbon County Health Department. So, and then also the hospital still has the ability to test if needed with their patients that come in there. And then a lot of local doctors have actually started testing as well. So we see that there is a good amount of people, a good amount of agencies in Bourbon County that are testing now. So with that, and with the decrease in participation that we've seen in our test site, we decided to go ahead and discontinue our testing here at the Bourbon County Health Department, because the need is being met in the community. Obviously, people are seeking this service elsewhere, and it's going to free up some time for us to transition and to focus more on vaccinating than doing the testing. And that's where, you know, our expertise falls in, and that's, you know, the health departments have been vaccinating for years and years and years. So that's where we want to transition our efforts and our resources to. So this past Tuesday was our last local test site that our testing day that people will be able to come through. And if we do see a need to pick that back up, we will absolutely do that. But right now, that's not where the focus is, and that's not where the need is. But just to give you a little bit of breakdown of our testing that we've been doing since mid-May, this is the age breakdown of who's come through, and we did not test anybody under the age of 18. So we were just doing 18 and older. And then, as you can see, these are the different counties from people who have, they came as far as Queens, New York to come get tested from the Bourbon County Health Department. So, but you can see we definitely serviced our county more than anybody. We had 1,331 come through that lived in Bourbon County. So we were excited to see that this is true, that we were giving our community the service that they need. And we're, you know, and we were happy to service people outside of the county too. But we definitely did see the majority come from Bourbon County. And then here's the results that we saw. And again, this is just through the Bourbon County Health Department test site. This is not any other test site locally or outside of Bourbon County. This was just the ones that came through ours. And so you can see we had about 4% positivity rate, and then 96% that were not positive. So I'm going to transition a little bit more now and talking about the vaccine. So we have Pfizer and Moderna. Those are the two vaccines that have been through the emergency use authorization through the FDA. And locally here at the Bourbon County Health Department, we are receiving the Moderna vaccine. Pfizer is a very, the way it is has to be stored in an ultra cold setting that many local health departments just don't have the capacity to do that because it's a special freezer. It has to get super duper cold, and the Moderna just has to be in a normal vaccine freezer that we already have on site. But you can see Pfizer's got about 90% is effective, and about Moderna is close to 95% effective after the second dose. So everybody needs to remember that's after the second dose. And then let's see. So like I said, Pfizer has to have that ultra cold freezing capability, and Moderna is just normal vaccine freezers. They have both been through the EUA and local health departments and pharmacies. And I know that Bourbon Community Hospital also had Moderna. They were actually got to receive a small shipment to vaccinate their own staff. So that was something that was taken off our plate, and they were direct shipped vaccine for their staff to do on site. So that was a huge help to us. And so upcoming, I know everybody's interested about upcoming vaccines. I don't know a whole lot about the Johnson & Johnson. I know submitted their EUA to FDA yesterday. So they're FDA, that's in FDA's hands now to process that that EUA, and hopefully that won't take long, and that'll be something that will turn around quickly, I hope. The wonderful thing about Johnson & Johnson that I think is going to be a complete game changer is that it only requires one shot, so only one vaccine. And right now there's a little bit of a logistic nightmare happening with the first and second dose with the Moderna and the Pfizer. I can only speak on Moderna since that's what we're receiving here. but both of them require 2 doses to reach that full 90% effective level. And so, you know, it's just a juggling act and a balancing act. We're going to get through it, and we're working very closely with the state health department to you know, figure out the loose ends and all that. But we're going to work through it, and we're going to get everybody vaccinated with their 2nd dose. Just, you know, because they're direct shipping us 2nd doses, so that's not an issue. It's just kind of the scheduling nightmares, trying to get people in. But Johnson & Johnson, hopefully that's something that's going to be out soon, and we're super excited about that. I know AstraZeneca has one. I don't know much about this one at all, so I'm not going to really speak on that, but I do know they are actively working on a vaccine as well. This is just kind of a quick guide to like the storaging and handling of the differences between Pfizer and Moderna. And Moderna is very sensitive. So there's 10 doses that come in 1 vial, and it's very sensitive. It's temperature and time sensitive. So once the vial is punctured, you have 6 hours to use the vaccines in that vial. So it's, you know, it's a lot of planning and making sure that people are here and or on the appointment list ready to go. And so we don't waste any. We are not wasting any vaccine. I promise you that. We will find an arm to put it in. And you know, some of the doses have what they're calling an angel dose, which is an extra dose or a bonus dose that might be in the vial. You never know if your vial is going to have that or not. It's just when you get down to the very end, you have to see if there's going to be enough for an extra dose or not. And then some of them they're calling them the devil dose, and they only have 9 vials, nine doses within them. So, you know, and again, you don't know that until you get down to the very end. So, you know, and then again, you have to use it within 6 hours. So super, super time and temperature sensitive. So we are doing our very, very best to make sure that we're not wasting any and they're going into arms. Let's see. This is the guidelines that the Department of Public Health and the governor's office put out with the phases. And I know I'm sure everybody's heard all these phases. So when we look at 1A, this is long-term care, residents and staff, assisted living residents and staff and healthcare. You've got 1B, which is persons age 70 and older, first responders, law enforcement, and K through 12 staff. And then 1C is persons age 60 and older, persons aged 16 to 64 with high risk conditions, and that could be attributed to COVID-19. And then the CDC defined essential workers. And there's a long list of what the CDC defined as essential workers. So we're not there yet at that phase. And I'll talk a little bit more on that in just a minute. And then you've got the phase 2, which is persons age 40 and older. And then phase 3 is persons age 16 and older. And then of course, our last phase will be children under the age of 16. And they are still doing trials on that age group right now. So that's not even been approved for anybody under the age of 16 as of yet. So we're still, you know, we're still anxious to hear that how that's going to roll out in the future. So right now, Bourbon County, I was happy to report yesterday on our Facebook that we have officially transitioned into the 1B section. And we got a couple hundred doses to the week of Christmas and New Year's to do our healthcare workers and first responders, and we got some doses to do our school health or our K through 12 school. And then I am so happy to report that it's not a lot, but it's some that for the next 3 weeks. Bourbon County will be getting 100 doses a week for the next 3 weeks. So that's 300 doses that we will be able to start chipping away at our 70-plus-year-old list. And I did we created a waiting list for those that are 70 and older that live in Bourbon County. And we are actively working with our website company to set up a appointment system that will be going out this weekend. And we'll just chunk it off for those first 100 that are on our waiting list, and then kind of just move down the line from there. We do have about 1,400 people on that waiting list, but we have encouraged everyone, if they have the capability to get in the car and drive to one of these other sites that have the vaccine, such as the Horse Park or UK Healthcare, to do that. They may absolutely get in quicker there than they can here. Some people can't do that. Some people don't have the transportation, or they don't have the ability to do that. So that's where the health department is going to fall in. We're going to help outreach to that vulnerable population, to that hard to reach population, folks that have transportation issues, who may be homebound, that kind of thing. So we're going to start chipping away at that list. So if we get to a person and they say they've already gotten it, then we're going to move on to the next person. So we're really excited to get that part of this puzzle rolling.
Hey, Andrea.
Yes, ma'am.
Sherry Lanter asked, what are the high-risk conditions for phase 1C? Is that on the CDC's website?
It is. I can't remember all of them. There's about a list of, I don't know, there's probably about 20 different conditions that that are on there, but I'm pretty sure that's on the CDC website, and it may also be on the Kentucky COVID19.ky.gov website as well. But if I find that, I can send that to you.
Okay.
I may actually have it right here. Oh yeah. Let's see. Well, wait a minute. No, that's healthcare workers. All right. If I find it, I'll send it to you. You can send it out. But I'm pretty sure it's on the CDC website.
Do you know if is asthma on that list?
I'm not going to speak because I don't know.
Okay.
I mean,
that was a follow-up question
that I'm not 100% sure on.
Okay.
So here's kind of a breakdown of what Bourbon County Health Department has received thus far since the beginning of the vaccine rollout. This does not include what the hospital has gotten, and this does not include Bourbon Heights, because Bourbon Heights was serviced by CVS Pharmacy. They were a part of the federal program, so they worked an arrangement with Walgreens and CVS to the long-term care and assisted living sites around the country. So they did that more on a federal level. That wasn't on a local level. And so we didn't have any interaction with that. But I will say that Bourbon Heights was vaccinated the early parts of January with their first dose. And then I'm pretty sure they've already had their second dose. And then anybody who wasn't eligible that first go around, they tried to get in when they came back on second doses to give them their first dose. So Bourbon Heights is being taken care of by CVS Pharmacy. But this is what we have gotten locally here at the health department. So the week of Christmas and the week of New Year's, we were able to get 100 doses each week, and that was specifically earmarked for healthcare workers and first responders. So we got those doses out, and we had a wonderful partnership with EMS to help vaccinate the first responders. So that was a huge help to us, and I think they ended up doing 80 first responders through that rollout, and then we took care of the non-hospital healthcare workers. So like I said, the hospital took care of their staff, and we reached out to the non-hospital healthcare workers. And then the week of January 18th, we received 400 doses, and that was specifically earmarked for the school staff K through 12. So we worked really closely with both superintendents and our private school to get a list pulled together of all the staff that wanted to get vaccinated for that, because the governor has, the governor prioritized them so we could get these kiddos back to school. And actually this week is the end of that rollout. So they did that for about 3 weeks in a row, getting vaccines out to all the counties so they could get the K through 12 staff vaccinated. And that comes to an end this week. So hopefully, fingers crossed that this will be a great movement in getting our kiddos back to school. But we were able to vaccinate, we had 320, we did 320 first doses. And this was 304, I think we did 340 first doses for teachers. And we did that. We did Paris and St. Mary on a Thursday evening, and then we did Bourbon County schools on a Saturday, and it seemed to work really, really smoothly. We had a great partnership. Again, EMS helped. They sent some of their paramedics over to help, and then the school nurses helped vaccinate too. So it was a well-oiled machine getting these people in and out. So we're going to repeat that all over again here in a couple weeks, get them their second dose. But after that, we had about 60 doses left over, because they round up our number to the nearest 100, because the Moderna only comes in allotments of 100. And so we had some 1As, healthcare workers still on a waiting list to get vaccinated. And then we got those done. And then we were actually able to start chipping away a little bit of our 70+ list. So we did get a few of those in with that extra 60 doses that we had left over from the school. We're super excited about that. And then, like I said, we got notified this Wednesday that they have decided they are pushing out vaccine to all local health departments based on population. And like I said, the Moderna comes in boxes of 100 doses. So you get 10 vials of 10 doses. So we get 100 doses, and we're going to get 100 a week for the next 3 weeks. And that's as far as we know right now. So we're in a phase right now, it's called a push phase, where they're pushing us vaccine, and a pull phase is where you get to actually place an order, and then they just ship you to the amount that you ordered. We're not there yet, so we're just now in that push phase where they're just basically saying, here, this is what we can give you right now. Hopefully pretty soon, fingers crossed that the supply or the distribution will increase, and we'll get more to where we can actually place orders for them and to meet that demand in our community. But as you can see, we've received, they call in the first dose prime. So they're calling that the prime dose, and they're calling the second dose a boost dose. So we've received 600 prime, we've received 200 boosts. And then we have administered at the close of business today, we will have administered 600 prime, and we've already administered the 200 boost doses to our healthcare and first responders. And then you can see, I've even broke it down a little bit further as to in grouping them out in 1As and 1Bs. So in the next couple of weeks, we'll be getting our boost doses for our schools, for our school staff, and getting those in their arms. And then, so I was going to talk a little bit about side effects and just facts and fiction about the vaccines. And I'm only going to speak on Moderna because that's what we receive here, and that's what our experience is. But when all this has come from the CDC, so you absolutely cannot get COVID by getting the COVID-19 vaccine. That is just not the way it was built. Some vaccines are built with a live virus, but at least with Moderna and Pfizer, they have constructed this vaccine, which is called an mRNA. And again, I'm not a scientist, so I can't really go into the nitty-gritty details about it. But this is something that it goes down into the cellular level, but not into the DNA level. So mRNA vaccines have been around for a very long time, and they've been in test mode for a very, very, very long time. So they did not cut any corners with the. I know it was done in an emergency use authorization, but they did not cut any corners to get to that. The safety protocols were all in place, and they just kind of cut through all the red tape that is there a lot of times when getting vaccines approved. And the vaccine will not cause you to test positive on a COVID-19 viral test. So you will not test positive on a test. You might test positive on a antibody test, and that's good because that's going to show that you actually have the built up antibodies for it. So because that's what it's supposed to do. People who have tested positive with COVID-19 may still benefit from the vaccine. Absolutely. People who have tested positive will have some natural immunity in their body. But what the science is showing is that it only may last for about 3 months, for about 90 days. So people who have had COVID should definitely still get vaccinated, but they may want to wait till after the 90 days is up. It's a total personal choice on that matter, because the only stipulation is you cannot get the COVID vaccine while you're still in isolation after testing positive. But once you're released off isolation and your symptoms have subsided, you are eligible for, if within your phase group, you are eligible to get it. But some people have decided to wait those 90 days, just in case, to make vaccine more available for others, because you still do have a natural immunity up until that point. And getting vaccinated can help prevent getting sick with COVID-19. So here's kind of what we need to know about this is the vaccine is to help prevent you from getting super sick. Okay, they still don't know if you're still going to be a carrier and be able to shed the virus if you've been around somebody affected with it. They still don't know if you can make, shed it and transmit it to somebody else. That information is still yet to be determined. So getting the vaccine is pretty much to help keep you from getting super sick and from you getting having to be hospitalized or getting put into the ICU. So that's why masks are still going to be in effect. That's why masks are still super important to wear. Social distancing is still encouraged. Hand washing, obviously hand washing for everything is encouraged. And I know there'll be a question about, well, after I get my second dose, do I still have to quarantine if I am been exposed to a positive case? You're not going to like my answer, but unfortunately, yes, that is still the case right now. Because like I said, they don't know if a fully vaccinated person can still transmit the virus to someone who's not been vaccinated. So that is, until there's a greater portion of our population vaccinated, those measures are still going to be put in place for now. Now, that's been a question that even us at the local health department have asked, our state leaders about, like, do we still have to quarantine after somebody's been fully vaccinated? And as for right now, the answer is still yes, but that may change in the future. Side effects, what people are seeing, pain or swelling at the injection site, and of course that's going to happen with any vaccine. Mild fever, chills, tiredness, and headache. I will say just from the 600 doses that we've given, for the most part, everybody does pretty well with the first vaccine. Not a whole lot of side effects. Some people experience some. A little bit more side effects on the second dose, but it's nothing that's going to take you down. I mean, you might be down for about 12 to 24 hours with like a fever, like a mild fever, not even a high fever, some chills, maybe a headache. But usually by the next day, you're feeling fine. So but that is definitely something we are seeing with people who get the second dose. So who cannot get the vaccine? Those under the age of 16, just because they've not been in the trials yet, and I know they are actively working on that. So that information should come out hopefully soon on whether or not we can start vaccinating those younger kids. Pregnant and lactating women doesn't mean you can't get the vaccine. It's just they were not included in the trials. So it's very important to consult with your doctor before you get the vaccine. And I know here locally at the health department, if you're pregnant or lactating, we are requiring you to have a doctor's note stating that they are okay with you going ahead and getting the vaccine. And those experiencing COVID-19 symptoms such as fever or currently positive with COVID-19 can't give it to you if you're not feeling great, and then can't give it to you if you're positive for COVID. So again, like I said earlier, you've got to be out of your isolation period before you can get the vaccine. And those who have been quarantined because they have been in close contact with a positive, they have to wait till they're out of quarantine as well before they can get tested. We want to caution people who had documented allergy, reactions to other vaccines or hyperallergies to other things that would require you to carry an EpiPen around with you. Those people need to be super cautious about this. And then anybody who's had a vaccine within the last 2 weeks, any vaccine, that could be a flu shot, that could be a shingles vaccine, any vaccine, you have to be 2 weeks out from that before you can get your COVID vaccine. So I want to just wrap it up with a quote from Dr. Fauci, and it says, "One of the greatest triumphs of medical science in dealing with infectious diseases have been vaccinations. It has saved hundreds and hundreds and hundreds of millions of lives." So that is, we are just encouraging everyone, when it's your turn, get vaccinated. And I think more people are interested in the vaccine now than maybe in the beginning, because now they're seeing other people that have gotten it are doing okay with it and they're doing fine. So I do think there's a little bit more interest now, which is great, which is super awesome, because we absolutely want to get as many people vaccinated as we can. It's just a slow moving process right now. And it's just simple economics with supply versus demand. We just simply don't have the supply to meet the demand, but we're working on it, and it's going to be a slow moving train, but anybody who wants to get vaccinated will. We just ask for your patience, and we ask for you to stick within your phased group, and then, it will come, especially with these new vaccines coming on the market. That'll be a game changer. Over time, we're going to have much more vaccine to be able to give out. Lauren, I know you sent me a few questions, and I don't have those in front of me.
You're fine.
I don't know if
I can ask them for you.
Okay, thank you.
You're not a problem. Most of them you have answered. I've kind of been checking them off as you have been answering them. One of the questions you haven't really answered is it possible for a husband and wife to schedule an appointment at the same time? Is it best if a husband and wife take the vaccine on different days?
I think that's a personal choice. If we can get you in at the same time, we will try our best to do that. And I guess maybe that question is because of symptoms, maybe one waiting till the other one feels better before the other one goes and gets it. I think it's just a personal choice. And like I said, the first vaccine, most people do really, really good with that. The second vaccine, you may have a little bit of achies and chills, but it's nothing that's going to take you super down. I mean, it's just one of those where you just kind of feel blah for about 12 to 24 hours. So I think that's just a personal choice.
Do you receive an appointment for your second dose at the time of your first dose?
What we do is we give them the date that they will be due. So I don't know if I said this earlier in the presentation, but Moderna, you have to be 28 days. The vaccines have to be 28 days apart with Moderna. It's 21 days apart with Pfizer. So they come in here, we give them what day 28 is. Now you can give through the guidelines with Moderna, you can do it 4 days earlier, or you can do it past the 28 days, but that's just kind of like around the ballpark recommended date. So what we do is we give them the date, what day 28 is, and then we reach out to them and schedule an appointment for their upcoming vaccine. So they know kind of a roundabout date to expect it. And, you know, we really encourage people to try their very, very, very best to schedule, you know, when we call and say, you know, this is the date, or you're going to know when you leave kind of what date you're expected to get your second dose. Because, you know, once we pop that vial, we have 6 hours to use that dose, you know, those doses. So we really need people to try their very best to keep their appointments and not try to kind of pick which day they want to do it on, because we've got to stick within those guidelines that Moderna has given us.
Okay. Kind of backing up to the first vaccine, will those where they're in the 1B phase right now, those in the 1B phase receive a email or text or call when they're ready to be administered, if they're signed up already?
We're working with our website company right now. Initially, they're going to get an email. So we're just choosing those. We're just, you know, taking out those first 100 chunks of those waiting list people. So they will receive an email. Now, if they didn't put an email on there, then we will call them and schedule an appointment for them. And I know we're going to run into issues with people saying, oh, well, I've already gotten it somewhere else, because we've had some people call us and tell us that they've already gotten it somewhere else, so we've taken them off the list. And I don't know if y'all know this, but there's a Bourbon County, Kansas. Did y'all know that? So we had 43 people signed up from Bourbon County, Kansas to get our vaccine. So we're going to take them off the list, so they're not going to get it here.
We've had that problem with Airbnbs here before too.
Okay. Yeah. So, so, you know, we have a spreadsheet of everybody who signed up on the waiting list. So we're going to go through that with a fine-tooth comb. And if somebody has not responded to the email that we sent, we're going to follow up with a phone call and make sure that they got the email. And if they did, they may tell us they got it somewhere else, and then we'll just move on to the next person.
Okay. It was stated that people from far away have come to get tested at Bourbon County Health Department. Will priority be given to Bourbon County residents for the vaccine?
Yes, absolutely. Yes. So right now we're only going to be vaccinating Bourbon County residents. So an ID will be required.
Okay. Does anybody else have any other questions before we wrap up? I think I want to make sure that I have one more question that I might not have asked.
Can I say something while you're looking for that question? So y'all have heard in the news and in the media that the UK Healthcare and the Horse Park have these kind of regional sites, or I guess the Horse Park is more a regional site. UK Healthcare is just a large site that is vaccinating. Now, I will say, I don't know what vaccine that the Horse Park is using, but I know that UK Healthcare is using Pfizer. So, but we've heard some really good experiences from that it's been a real smooth transition. That UK is kind of a waiting list situation, and I think the Horse Park is you actually schedule an appointment. But I've heard UK will reach out, very quickly. They're getting like 10,000 doses a week. I mean, so I think chugging some people out of there. So so we are encouraging, if you have the ability to get in a car and drive to these sites, whatever phase we're in, you very well may get a vaccine quicker there than what we are getting here. Because like I said, we're only getting 100 doses for each week for the next 3 weeks. And those sites are just getting a much larger amount than we are. So if you do have that ability, you may want to try that route. If you don't have that ability, then please, we will get to you as soon as we can.
You may have touched on this a little bit in a kind of a round robin way, but I'm going to ask this just in case. Do you still have to be tested for COVID after you've had the vaccine? If you do, how long should you wait? And if not, how long after the vaccination can you stop being tested?
Okay, so the vaccine, okay, so when you get the vaccine, you're not going to ever test positive after you get the vaccine because it just doesn't work that way. So if you have been exposed to somebody, so after you've been vaccinated and you feel like you may have been exposed to somebody, or you start being symptomatic, you need to go get tested. And that can be at any point in time. I don't think that there's an end date to that because, as long as there's active spread in the community, then, people are still have that ability to contract COVID. Like I said earlier, the vaccine is just to keep you from getting super sick. It doesn't mean that it's not 100% sure that you're never going to catch COVID. Even though there's that 95% efficacy, which is huge, it's probably a lot less likely that you're going to get it or you're going to get sick from it, but it's not 100%. So if you are symptomatic or you feel like you've been exposed to somebody who has had COVID, you can get tested at any point in time because it's not going, after you get the vaccine, if you go get tested and it's positive, that means you're positive. It doesn't mean that the vaccine is reading into that at any, because you can't test positive just from getting the vaccine. And we've had a couple people who have tested positive after they got their first vaccine, but that's just because the virus was already in their body, because there's still that incubation period. So, you still got about a 14-day incubation period for it to actually break down in the body. Lots of people try to, as soon as they know they've been exposed, they want to run out and go get tested, but that's not really accurate, because you should wait 4, 5, 6 days after you've been exposed to give your body time for the test to actually pick it up. So that's why the PCRs are a little bit, in my opinion, they're a little bit better, just because they're more sensitive and they're going to pick that up a little bit quicker than maybe a rapid test, especially early on in the incubation.
I know some people are having positive antibody tests after they receive their first dose. Is that just because partially it's covering? Is there a percentage to that, or is it?
Yeah, you're right, exactly. So there is a percentage. I'm not going to quote what it is because I'm not 100%. But yes, after the first dose, you should start building immunities. And so your antibodies should be starting to pick up on an antibody test. And then after you get the second, that's why they call it a boost, because it's kind of boosting those antibodies to that highest point. So yeah, somebody could start seeing positive antibodies after the first dose.
Oh. Does anyone have any questions? Other than that, I believe that we are finished. Andrea, do you have anything else that you want to wrap up with?
No, just everybody be patient with us. We're going to get you vaccinated when we can. But continue to wear your masks and social distance, and wash your hands, and stay safe. We're going to get through this.
Thanks, Andrea. I appreciate it.
All right. Thank you.
Have a good day.
Appreciate
Bye.
it.